alongside his two agents, Boaz Sila Oseko and Samuel Murungi. Mumbi Wambugu reports.
EACC has been on a hunt to recover public property acquired illegally by present and former government officials. In Nakuru County, the Commission has been able to recover several public property, of which most are prime public lands. Today, a land worth 40 million Kenyan shillings at the heart of Nakuru CBD has been recovered.
We want to urge every grabber, every thief who could be in possession of public property to consider using the alternative dispute resolution, because the EACC is under the law allowed to enter into negotiations and discussions with the thieves with a view to assisting them return what they stole from the public.
EACC spokesperson Eric Gumbi has said that the prime plot is among 3 other pieces of land whose recovery is on the pipeline.
The 4 units are part of a larger property that is public land with 24 units on it that had been grabbed by a former member of parliament in this area, but so far 20 of them have already been recovered in one judgment.
Simon Sangale, the chairperson of Karimbak Stall Owners and Traders in Nakuru CBD, has urged EACC to fast-track the recovery of a trader's land that was recently grabbed by a local MP, which has led to loss of jobs for hundreds of traders.
Mji wa Nakuru umekuwa kama ni ile headquarter ya wanyakuzi wa ardhi. Na kama vile ambavyo muliweza kurecover 20 houses ambazo zilikuwa zimenyakuliwa pale katika Karimbak, na pia mumeweza kurecover hii ambayo tuko mahali hapa, tunaomba kwamba muweze kuharakisha haraka iwezekanavyo, kwa sababu tumelia kwa serikali ya county hatujasikika.
Thika Land Registrar Felix Mecha Nyekundi was also arrested after he demanded and received 400,000 Kenyan shillings from the complainant as a mandatory condition in what the registrar referred to as facilitation fees before he could issue the complainant's title deed. He was arrested alongside his 2 agents, namely Boaz Sila and Samuel Murungi, who allegedly ran his bribe collection scheme.
Thika Land Registry is one of the areas that are problematic because based on the complaints that members of the public continue to make to EACC, it becomes difficult for people to transact in matters land without bribe demands, and the EACC will stop that behavior.
Mumbi Wambugu, K24 TV, Nakuru County.
Education Cabinet Secretary Ezekiel Machogu has expressed the government's commitment to support higher education institutions through various funding models and partnerships. In a speech read by the director in charge of planning, Julia Chepkieni, during the launch of the Laikipia University Strategic Plan 2023-2027, the CS said challenges facing the education sector require innovative solutions and a forward-thinking approach.
From the few years I've worked, I think this is the hospital at the moment is the best equipped with the latest model of equipment that we require. I don't think we have what we call that cyber knife. You have the PET. You also have the best CT scan, the oncology department. I think it has exceeded in terms of services. It has exceeded KNH. And this is a place for our students.
The only best competition we have in the world today is collaboration. And we have been looking for collaborators both locally and internationally. And sometimes we make a lot of mistakes. We travel all the way to Europe to look for collaborators. But you forget that the best and the most productive collaboration is just next door. So collaborating with KUTRH is actually something that to us is a no-brainer. The projected future of this partnership. I'm happy to note that the Principal College of Health Sciences and his team of 5 deans of schools are eagerly waiting for this agreement to be signed so that their students and staff can start using this faculty for attachment and internship.
East Africa Breweries Limited is launching an environment conservation program dubbed Rudisha Program that seeks to promote recycling of bottles used in liquor packaging. EABL says strategies have been put in place to ensure that it gets to achieve its target on environment conservation by 2030. EABL produces over 80 million bottles of liquor per year. When disposed, they contribute to environmental degradation.
Earlier this year, the East African Breweries Limited announced the 190 million shillings Water Conservation Fund, seeking to preserve Kenya's water sources. And now, the company has launched yet another environmental conservation program.
Rudisha is an initiative which we started 2 years ago. It's a purely an environmental initiative. As you know, EABL has a clear targets for Spirit of Progress 2030. A clear target on how we want to reduce our emissions to the environment in the next, now we have how many years to go? 6 years.
The company is seeking to reduce wastage by recycling liquor bottles.
You have seen we have managed to recycle water. We managed to bring in biomass to give us, to save on energy. So the next step then was looking at our packaging materials. And the biggest question was if beer, which is also a product, goes to the market, we consume it and bring it back to refill and take it back to the market. Why not spirits? Yeah. At the end of the day, if the glass is left out there, it's thrown somewhere, it's harmful to the environment, it's harmful to human beings, it's glass. So it's very important as a business. We started thinking about how do we want to bring back this glass into the production line.
In recycling the spirit containers, the company collects the bottles from their agencies across the country, cleans them through a thorough automated process, refills the bottles and package them for selling.
Rudisha glass is part of the returnables, so that makes me accountable and responsible for the Rudisha glass handling process in logistics. So basically what I do, I take care of loading of empty crates to the customers out there in trade. That is our distributors. The distributors then take the empty crates and they load the glass, the Rudisha glass, in the empty shells. The empty shells then comes back to KBL through logistics department. We then offload the glass. The glass is washed, pre-washed for then packaging. After the packaging lines have cleaned the glass, washed the glass, they give them the glass back, the cleaned glass back to logistics. Then we transfer the glass, the Rudisha glass, to UDV plant for packaging of the two brands.
With 6 more years before 2030, EABL believes it will achieve its goal of maximizing on measures of conserving a clean, green and sustainable environment. Anthony Kwemoi, K24 TV, Nairobi.
The government will be required to allocate more funds and resources into the treatment and prevention of TB in order to end the disease as a public health threat by the year 2030. This was disclosed during a health caucus in Naivasha, bringing together experts drawn from various institutions in the country. And as Gertrude Brigay reports, only a few counties have been able to prioritize this move, a challenge which is said to be a setback towards the gains achieved to attain the goal.
Kenya is among 30 countries that contribute to 80% of the global TB burden, according to a WHO report. Stakeholders at the Naivasha Health Caucus identified the lack of sufficient government funding as a significant challenge.
And where do we...
During the Health Caucus, experts from various institutions highlighted a funding deficit of at least 40% needed to alleviate the TB burden in the country.
What some of the benefits?
The stockout of TB commodities, including drugs and vaccines, was listed as a major challenge. Officials noted that inconsistent supply severely affects the treatment process for TB patients.
Recently, again, we had a stockout of vaccines, including BCG. BCG is the only vaccine that we have that is working for TB. And even as it is, it's not effective for a lifetime. It only prevents from the very severe forms of TB among children. So when even we don't even have that one, again, it's exposing young children with very low immunity to TB. I mean, that's a very serious issue.
Community system strengthening programs in TB-affected communities were identified as a critical need. Stakeholders emphasize that at least 80% of TB burden lies within these communities.
The other problem is, the challenge, is low levels of awareness. We may assume that people know about TB, but if you go out there to the communities, people are suffering from TB, but they do not know what they're suffering from is TB because they do not even know the basics of the basic signs and symptoms of tuberculosis.
The TB program has a very good visionary strategic plan that talks about community engagement. We need to see these communities. At the national, we are doing good because we sit in different technical working group. But at the county level, that's where we have challenges. So we need to see these also at the county level, even at the sub-county level, whereby when the discussion is all about TB, we need to see a TB-affected community member coming in and bringing their voice and their input into these policies.
Further, investment into computer-aided technology for TB diagnostics is still work in progress in many hospitals across the country. This gap hinders access to quality TB treatment.
We need to ensure that we have intensified TB diagnostic, so that even at the grassroots level, at that point, that my next door, where there is a health facility, I need to have access to highest diagnostic materials like Gene Expert.
To date, only a few counties have prioritized proper care and prevention measures for TB. According to officials, this has indirectly reversed the gains made towards ending the disease by 2030.
The smaller bit, we have something we are calling iMonitor, which is an alert system where somebody goes to a health facility and probably there are no drugs. They just report in an application using their phone to say this facility is lacking drugs. That is important to help the counties. For example, some of the counties like Homa Bay have taken up this seriously and are able to really say we have drugs in point B, point C is lacking. How do we ensure that those drugs move there? But in a bigger picture, essentially, is to really say, then now what do we do with all this information that is coming from different places? It then forms a bigger aspect of national level advocacy with the policy makers to really say, what is it that we can then do?
Thank you very much.
Gertrude Burgay, K24 TV.
Well, on that note, we take a very short break. More stories to come. Stay with us.
Step into a world of emotions, relationships,